For a lot of us in the digital health section, it all started with a very simple vision: remote access to mental health care for all, fast, unparalleled reach to those who needed it the most, high quality clinical care every time. Remote was supposed to be the best of face-to-face, just easier, cheaper, and more convenient. So where are we now? We've all lived through a time of unprecedented difficulty. We are all aware of the effects on the economy, the effects on the NHS, and even closer to heart, we've seen the effects of the pandemic on not only the physical, but the mental health of ourselves, our friends, and our families. As we all know, in March and April 2020, GPs and community mental health services underwent a process of rapid virtualization. Almost overnight, consultations were being conducted remotely. And with all the benefits, we opened a Pandora's box of challenges. My name is Hasanic. I'd like to introduce my colleague, Ohri. Together, we will present the key findings from our dissertation, A Remote New World. I invite you to join us on a journey through the benefits and challenges posed by remote mental health consultations.
In this project, a remote consultation will be used to describe the use of video or telephone when providing care to a patient at a site distant to the physician. You may know it as telehealth, teleconsultation, as one of the mission-critical areas for the NHS digital health agenda. Even though remote consultations have existed for more than 140 years without becoming mainstream, the 2019 NHS long-term plan states that in the next 5 years, every single patient will have the right to remote consultations in general practice. The forefront of this digital health agenda has been pushed forwards, accelerated by COVID-19. Mental health has been called the next pandemic. The catalytic impact of COVID-19 on the mental health crisis suggests a 33% increase in demand over the next 3 years, with demand greatest in primary care and community mental health.
Remote consultations hold merit as a possible solution. The APA considers remote consultations in terms of feasibility, reliability, validity, and satisfaction as outstanding. Commissioners see them as a potential force multiplier for low cost and rapid service scale-up, increasing workflow efficiency and extending providers' reach. But what do the frontline physicians say? What do these individuals, backed into a corner by the force majeure that is COVID, say of these changes? What is their vision of remote access to mental health care for all?
We set out to answer the following research question: what are the physician benefits and challenges to using remote consultations for the diagnosis and follow-up of general adult mental health patients in the community? Following a systematic literature review, we pursued an exploratory sequential mixed method study design. Data from our interviews were used to construct our survey questions, allowing us to test the generalizability of our interview findings using the survey. Integrating qualitative data in the form of semi-structured interviews with quantitative findings from a national survey to provide a more comprehensive picture than either approach could achieve alone.
Our research highlighted some very interesting points, many of which have already been highlighted in the literature. Firstly, teleconsultations were suitable for anxious and depressed patients. However, they were less appropriate for initial consultations and high-risk patients. Hindered relationship building and a lack of non-verbal cues impeded the ability of doctors to perform mental state examinations. Secondly, remote consultations are convenient and reduce travel time and costs. However, they may exacerbate digital inequalities for patients who lack access to technology. Thirdly, efficiency of appointments can increase with teleconsultations. However, a lack of training of this technology was found to be a consistent problem and may mitigate this efficiency. Indeed, more than 70% of those surveyed found it difficult to set up and navigate video platforms. Finally, participants identified that resistance to change and a technophobic culture has been a major challenge of teleconsultation use.
Findings from the literature review were compared with the findings from our mixed method study. Here we discussed the novel findings that hadn't been reported in our literature search. Firstly, the benefits of queue virtualization. The lack of patients in physical waiting rooms can serve to reduce pressures on physicians and provide patients with more flexibility to carry on with daily tasks. Secondly, ethnic minorities are becoming disadvantaged by teleconsultations, as stated by more than half of our survey respondents, due to language barriers that are exacerbated by technology. Finally, clinicians are developing more creative ways to utilize the technology, enabled by prolonged use of remote consultations through the pandemic. A key example being clinicians screen sharing to signpost resources to patients.
A key challenge identified both in our literature review and interviews was the clear lack of training. Clinicians don't just want to know how to conduct a remote consultation, but ultimately how best to leverage this new medium to the benefit of both their practice and their patients. To address this, we've developed our own Connect framework, a simple but memorable mnemonic, providing targeted solutions to the challenges raised in interviews. Consent and confidentiality. Take care to explicitly consent and check the patient is in a confidential setting. Open communication. Minimize interruptions and be transparent if you are also taking notes or checking guidelines. Non-verbal communication. Be aware of the difficulties and advantages of non-verbal cues in the context of video or telephone. Netiquette. Professional virtual etiquette increases the patient's confidence in your abilities beyond solely your technological skill. Engage. Allow the patient to direct the consultation more to improve engagement. Contingencies. Make and communicate your contingency plans before technical issues arise. And what we're most excited to present to you is T for transform. Transform your remote consultations. Use a dynamic video consultation style and further functionality to improve care. If you're talking about diet and eating habits, you can ask patients to take you to their fridge. The possibilities really are endless.
This framework can be found in our unique Remote New World Guidebook, providing comprehensive advice to ensure a seamless remote consultation, whilst being specific to mental health. We hope to distribute this guidebook to clinicians across the country to support them in the delivery of remote mental health consultations. To access this guidebook, please do see the link in the description below. We'd be so grateful for any feedback.
Thank you for listening. I hope we've impressed upon you the urgent significance of the next pandemic, a mental health crisis, and how we can tackle it, distanced but together, in a remote new world.